Hey guys, this is Dr. Hub. Today we'll look at the brachial plexus. So the brachial plexus, it includes from C5 to T1, and the roots, the question on the roots, it is from the spinal cord, and this will be greater than the trunks. So trunks, and this will be in the neck. Then comes the divisions. So division is passing behind clavicle. So it passing behind the clavicle. Then comes the cords and branches. So cords and the branches. So they are present in the axilla. Cords and branches are present in the axilla. So they are covered by a prevertebral fascia. So they are covered by prevertebral fascia. So this prevertebral fascia extension is called as the axillary sheath. So the extension is nothing but the axillary sheath. Next we are looking at the trunks. Now what is a trunk? The trunks, it includes the upper trunk. There is upper trunk will be C5, C6. Next there is a middle trunk. Middle trunk is nothing but the C7. And then comes the LT. LT is nothing but the lower trunk. Lower trunk is nothing but the C8 as well as the T1. Now what are the divisions of the brachial plexus? The divisions, there is a anterior division as well as presence of the posterior division. So anterior division, it forms the lateral and the medial cord supplying mainly the flexus. So it forms a lateral as well as a medial cords. So it forms the lateral and the medial cords, and it supplies mainly the flexus. So it supplies a flexus. Next question arises on the posterior. The posterior divisions, it forms a posterior cord. So it's simple, posterior forms a posterior cord, and it supplies mainly the extensors. So supplying the extensors mainly. Then we move on to the cords. So under the cords, it includes the lateral cord, posterior cord and the medial cord. So the lateral cord, it is formed by the anterior division of the upper and the middle trunks. So it is by the anterior division, and this is of the upper and the middle cord. Anterior division of the upper as well as a middle cord, middle trunk. So the anterior division is formed by the upper and the middle trunk. Then we have the posterior. The posterior cord is formed by all posterior divisions. So all posterior divisions, and then comes the medial cord. The medial cord is formed by the anterior division and anterior DVN. Let's write it as DVN. So anterior division of the lower trunk. Lower trunk. Now let's look at the branches. So in the branches, it includes, let's look at the roots. So under the branches, let's look at the roots. So roots is the branches, it includes the dorsal scapular nerve. So dorsal scapular nerve is nothing but the C5. Next what comes is a long thoracic nerve. So long thoracic nerve of the bell. So this is C5 to C7. So DSN, that is a dorsal scapular nerve, is C5. The long thoracic nerve of bell is C5 to C7. Then looking at the upper trunk. The upper trunk has a suprascapular. So suprascapular nerve, and there is also the nerve to the subclavius. So nerve to the subclavius. So the suprascapular nerve will be the C5 to C6, and the subclavius will again be C5 to C6. Then we look at the lateral cord. So looking at the LC, there is a lateral cord. We write it as LML as well. So here this includes the lateral pectoral nerve. So there is a lateral pectoral nerve, and that is nothing but C5 to C7. And then it also includes the musculocutaneous nerve. Musculocutaneous nerve is nothing but again C5 to C7. And then there is also the lateral root. The lateral root is nothing but the median nerve, and this is again C5 to C7. Next we'll have the medial cord. The medial cord is nothing but the UMN4, and what it includes is the medial pectoral, that is C8 to T1. Next, There is also the medial cutaneous nerve of forearm. The medial cutaneous. The cutaneous nerve, and this is of the forearm. Medial cutaneous nerve of the forearm. This is nothing but the CA to T1. Next is there is a medial cutaneous nerve of arm. It also includes the medial cord. The medial cutaneous nerve of the arm. So this includes the CA to the T1. Then comes the presence of the ulnar nerve. The ulnar nerve is nothing but the CA to T1, and then is the medial root of the median nerve. So the medial root of the medial nerve. So medial root of the median nerve is nothing but the CA to the T1. Now let's look at the posterior cord. The posterior cord is nothing but the STARS, and what does it include? There is the upper scapular nerve. So there is upper scapular nerve, that is nothing but the C5, C6. Then comes the thoracodorsal nerve. The thoracodorsal nerve is nothing but the C6 to C8. Next is the axillary. Axillary is C5 to C6. Then comes the radial. The radial will be the C5 to the T1. Lastly, the lower scapula. The lower subscapular. This is going to be the C5 to the C6. So let's look at the diagram. Before, we need to also note that the ulnar nerve is near its origin. It receives a communicating branch from the lateral root of the median nerve. So if you look at the ulnar nerve, near its origin, it receives a communicating branch from the lateral root. So it receives a communication branch from the lateral root, and this is of the median nerve. So the lateral root from the median nerve originating from the lateral cord. This originates from the lateral cord and carries fibers from the C7. So this is an important point to note. So now let's look at the diagram. So we have already explained in detail. So here we are just going to focus on the diagram. So this will be the root. So root, we have the C5, C6, C7, C8 as well as the T1. So what is happening? We are joining the C5, C6, then 7 comes along, and C8, T1. So all this, they form divisions. So here all branches, they unite. So all these branches, upon uniting, it forms a long thoracic nerve. So let's look in brief. So roots, so you have the roots, it divides and then it forms the trunks. In trunks there are also again divisions. So this will be the superior, medial and the inferior part of the trunks. These are nothing but the trunks. And in the trunks you have the nerve to subclavius as well as the suprascapular nerve. And in the roots you have the long thoracic nerve as well as the dorsal scapular nerve. So after the trunks there comes the divisions. So we were left with the C5, C6, C7 as well as a C8, So next is the divisions. The division is where it divides into anterior and the posterior. So it divides. So there is a divisions. So this is how it unites. So in the superior it forms a posterior divisions. It unites with the C7 as well as the posterior division of the T1, C8, T1. So all these they unite. So it forms a W pattern, and next it proceeds into the from the C7 branch there is also an anterior branch which is uniting to the superior branch, superior trunk. Now they proceed as cords. So let's label this for easier understanding. So we saw these are nothing but the trunks. This is superior trunk, this is the middle, and this is the inferior. And to make it simple, we'll put a P and A so that it's easier to understand. So this is the anterior branch, this is the anterior branch. This is nothing but the posterior branch. This is again the posterior, and this will be the posterior, and this is going to be the anterior. So all these, it proceeds further and it forms the cords. They proceed further and form the cords. So under the cords, there is again the lateral posterior and the medial. There is lateral, posterior and the medial cords, and they can, and all this together, they also form the lateral pectoral nerve, the medial pectoral nerve, the upper subscapular nerve, the thoracodorsal nerve, the lower subscapular nerve, the median cutaneous nerve, and the medial cutaneous nerve of the forearm. So all this, they arise from the cords respectively. And then post the cords, there are the terminal branches. So again it branches, there is the terminal branches. So again it can club, so the divisions in the terminal branches, there is the fibers to the C7 of ulnar nerve, there's axillary nerve, there's ulnar nerve, there's radial, there's median as well as a musculocutaneous nerve. So all these, they arise from the terminal portion. So to name a few, there is the axillary, there is also the ulnar. So how they branch? So the axillary is C5, C6. The ulnar will be C8, T1. These are very important to know, the root values. The radial will be the C5, 6, 7, 8 and the T1. Next, there is also the median. The median will be C5, 6, 7, 8, T1, and then the musculocutaneous. The musculocutaneous is nothing but the C5, 6 and 7.